Hi, and welcome again to our exploration of complex dental cases. Here today we're looking at a case where the patient presented to us having been recommended by a family member, and they have had some dental work, some dental implants placed in the upper region. You can see it in this vicinity here on this x-ray. And the patient was actually promised fixed upper teeth solution, and unfortunately they were not provided with the solution in the end, and they sought to have the situation remedied. So what you can see is on the x-ray is these 4 implants placed by the dentist who undertook the initial work, and these long attachments are called locators, which are meant to secure the denture in place. They act like little buttons that click onto little opposing members on the denture and retain the denture in that way. However, in this situation, without implants at the back, the denture can move in the back areas, and sitting on soft tissue, which is gum, the denture can compress and move during function, and the retention is not very good. And in a later image, you'll see that the angulation of these implants were not ideally placed also. Hi, and welcome to Modern Dental Solutions, where we handle complex and exceptional dentistry every day. Okay, so if we look more closely at the work that was done by the previous dentist, you can see that this implant here is relatively short, and they're all relatively small diameter. This is short because it involves the sinus area in this patient, and this sinus on both sides in this patient is extremely large, unusually large. In fact, most sinuses aren't quite this large, and so the dentist who this patient went to was unable to manage the situation appropriately to provide them with the fixed solution that they were after. Okay, so that last image was an OPG image, a two-dimensional X-ray. This is a similar image derived from a 3D X-ray, and what you can see very clearly is that short implant is protruding a little bit into the sinus. Nothing particularly wrong with that, but the implant is short, so it's not going to be able to support things as well as a longer implant or a wider implant. The other issue that you can see is that the bone around the sinuses is eggshell thin in some places and almost non-existent, as in this area here. So you can see that there. On the other side, very, very thin, no space to put an implant. It'll simply perforate into the sinus. And if you look at the sinus, you can see how enlarged that is compared to the nasal cavity. So an unusual case, but not unheard of. Nothing that we haven't dealt with before. And if we look at a further 3D image in a different plane, in a different section, the 3D X-ray shows us how thin, almost non-existent, that bone is around the sinus areas. And so this is the reason why that last dentist was not able to manage this appropriately. Moving along, in yet another plane in the 3D imaging, again, extremely thin bone, very large sinuses. These are these implants at the front that you can see, but the sinuses are extremely enlarged and the bone around them is extremely thin. Essentially impossible in this situation to place implants that will be retained for any duration. And then moving along, we did grafting. So we grafted the sinuses and the bone ridges. And what you can see now in these really white and dense areas is our grafting. So this is our image after bone grafting of the sinuses. So plenty of bone now and plenty of height for us to place implant in the back areas. Now, if you're interested in seeing the actual sinus lift or sinus grafting procedure, there is a video in our Facebook page. So it's Modern Dental Solutions on Facebook. A little bit of surgery involved in that. And for those who are interested, you can watch that. Okay, so we've got plenty of bone. And so we progressed to do the treatment. So this is here. We're fitting so all the implants have then subsequently been placed and a period of healing has elapsed. And here are what we call the healing abutments. And today we're about to fit the components that will support the final fixed prosthesis or fixed teeth for the patient. And so here we fitted 2 components. Now what we've had to do in this situation, because the previous dentist placed the implants in a strange angulation, the screws would have headed out to the front of the teeth and protruded through the front surfaces of the teeth. So we've had to use special components to re-angulate the screw holes appropriately. So these are the 2 similar ones will be placed in this area here, and these little healing buttons will come out, and these will have direct to implant connection with the prosthesis as we've designed them. Okay, so moving along. Okay, so this is 3 weeks after completion of the upper prosthesis or upper teeth in June of this year. You can see the patient has very fixed, very much fixed teeth, unlike the removable and moving mobile dentures that he had with his prior situation. And here are the x-rays of the work that we've done. And what you can see is these are the original implants done by the other dentist, and there's a short front one, and these are the components here that we've had to utilize to change the angulation. And whereas we went to direct to fixture or direct to implant, here the components are milled out of titanium as one piece and directly screwed onto the implants directly there. So you can see the fit is very accurate. There is no spaces and gaps. So very good result for the patient. The patient was very, very happy. And this is just those front re-angulation components on the model. And you can see that it's an additional component that we've had to use to correct some of the work that was done at the front by that other dentist. See our other cases on our Facebook page. We take care of the entire process unless you are referred for a specific surgery or procedure. Remember, when choosing a dentist for complex work using social media, make sure that they can provide you with a diverse and abundance of examples of their work, as we do on our Facebook page. Modern dental solutions for all your emergency and pain relief, root canal therapy, complex dentistry, extractions, dental implants, and bone grafting needs. All photos are taken by an iPhone or a Samsung phone or a small 12 megapixel handheld camera. Photos are not modified or enhanced except for cropping and labeling.